This is Dr. Jesse Dominguez from Cucamonga Valley Medical Group, here to discuss certain over-the-counter medications that can be used to help alleviate some of the common cold and flu-like symptoms. We are living in challenging times, with the coronavirus, also known as COVID-19, causing problems in our communities, in our nation, and around the world. It's important to know the active ingredient found in a medication as to not over-medicate. Just because one particular medication is causing symptomatic relief doesn't mean that doubling up or even tripling up on that medication can be more effective. It's not, and it can be dangerous. There are certain medications that contain 2 or 3 active ingredients. This is known as a multi-symptom drug. Combining a multi-symptom drug with another medication that may contain the same active ingredients can be harmful and should not be combined. The second thing I wanted to stress is the importance of not self-medicating with antibiotics. Antibiotics do not kill viruses that cause the cold, the flu, or coronavirus. Antibiotics should be taken under the supervision of a provider or a physician solely for the purpose of fighting a bacterial infection. In our pediatric population, it is important to give the age-appropriate dose. If you have any questions, please contact your pharmacist and/or your provider or physician. Tylenol is used to treat fever and pain. It is effective for ages newborn and above. Ibuprofen is also used to treat fever and pain and can be safely given to ages 2 years and above. For children complaining of nasal congestion or runny nose, the use of a ball suction or a nasal saline rinse can be effective to improve airway passage within the nostrils. Children's Claritin and children's Zyrtec are both used for allergy-like type symptoms, both appropriate for ages 2 and above. The use of Afrin for cold and allergy symptoms can be effective to decrease production of the nasal passages and effective for ages 6 years and above. An example of a multi-symptom drug is children's Dimetapp and children's Benadryl. Both are used to relieve runny nose, sneezing, itchy eyes, and itchy throat. Children's Dimetapp also contains dextromethorphan, which helps with cough. Children's Benadryl contains diphenhydramine, which can be sedating and should be used with caution. In adults, Tylenol is both safe and effective to use for fever and pain. Ibuprofen is also used for fever and pain and should be taken at the appropriate dosage. If you experience any GI upset or abdominal pain, you should stop taking this medication and notify your provider or physician. There is a group of medications that should not be taken together with ibuprofen because they fall in the same class of meds. And these include naproxen, Advil, and Aleve. If an individual is experiencing a runny nose or nasal congestion, just like in the pediatric population, the use of a saline rinse can be cost-effective, safe, and can be used multiple times throughout the day. The nasal sprays, such as Flonase, Nasonex, and Nasocort, help with decreasing inflammation and mucus production to improve airway passage in the nostrils. The use of pseudoephedrine is also effective to dry up the nasal passages and improve airflow. Lozenges are very effective for use for individuals who are having irritating, scratchy throat. It can come with or without honey. The use of Theraflu is a multi-system relief drug that is both helpful in relieving the symptoms of fever and body aches, but also that irritating, scratchy throat. It's indicated for individuals 12 and above. Experiencing chest symptoms, such as a cough, it's important to know which type of cough you're having. If it's wet, if it's productive and phlegmy, then the use of guaifenesin is very effective. It's an expectorant and it can help bring up the mucus. If the cough is dry and you've been complaining of cough throughout the whole night and experiencing it during the day, the use of dextromethorphan found in Robitussin and Dayquil can also be very effective. Dextromethorphan works at the level of the brain and helps suppress your cough. Individuals who are asthmatic, who have COPD or emphysema, should continue to use your inhalers if they experience wheezing or shortness of breath. If the shortness of breath becomes worse, they should seek medical attention. Patients with diabetes should be taking medications that are sugar-free and do not contain ingredients such as Sudafed and phenylephrine. These can elevate blood sugars. Diabetics should also take products that don't contain high fructose corn syrup or alcohol, as these can make diabetes worse. Patients who have hypertension should avoid decongestants that contain pseudoephedrine and phenylephrine, as these can elevate blood pressure. Hypertensive patients can take a line of products called Corticidin HVP that are decongestant free and are safe and effective to use as directed. Lastly, I wanted to discuss water and vitamins. It's important to always be hydrating well, especially during times of illness. As a general rule, we should be consuming half our body weight in ounces. For example, if you weigh 160 pounds, that's 80 ounces of water. That's equivalent to 5 bottles of 16 ounces. Products that contain vitamin C, vitamin D, and zinc are helpful to sustain and maintain our immune system. I want to thank you for listening to this video. I hope it was informative for you and your family. This is Dr. Dominguez from Cucamonga Valley Medical Group. Thank you and God bless.